My name is Carrie Wade, and I'm my name is Carrie Wade, and I work at PMI in scientific engagement. And I'd really like to thank the organizers for allowing me to take this spot so that I can make my flight when I have to leave a bit early today. Following on the theme of flux, we're moving from ammonia flux to nicotine flux, and I'd really like to give our perspective on the applicability of nicotine flux in tobacco products regulation. As newer technologies that deliver nicotine have advanced, some regulatory schemes are really trying to define ways to balance abuse liability with the potential for these products to help smokers move away from combustible cigarettes. For example, nicotine limits have been adopted by the Tobacco Products Directive that aim to bring parity to cigarettes and e-cigarettes in terms of nicotine delivery. However, a simplistic target like nicotine concentration limits have been called into question as there are many factors that influence nicotine delivery from a product. Towards that end, nicotine flux has been examined over the last several years, and recently a protocol to examine nicotine flux and the relationship between flux and abuse liability in clinical trials has been proposed and put into protocol about last week, I think. So what is nicotine flux? Nicotine flux is defined as the rate of nicotine emissions from the device. We evaluated nicotine flux across a variety of products through different routes of administration, and we found that the highest nicotine flux is delivered through nasal and mouth spray, and the lowest nicotine flux is delivered through nicotine patch, or delivers nicotine through the nicotine patch. Previous evaluations across these products have shown similar results, but we've extended this to include more routes of administration and more products. For flux to be a viable target, there is an assumption that there is a direct relationship between nicotine delivery from the device and nicotine delivery to the person in terms of systemic exposure to nicotine. And it also assumes that a high flux product is positively correlated to abuse liability. So a high flux product would have a higher abuse liability. Evaluating the relationship between nicotine flux and nicotine dose through a variety of products, we see almost no relationship between flux and dose. As you can see here on the left panel, a dose of 1 milligram can be delivered through products that have a range of nicotine fluxes. But we did see that based on products that are currently available today, there's a relationship between nicotine flux and the intended duration of use, where a product with a duration of use of a few milliseconds has a very high nicotine flux, but a product with a duration of use, intended duration of use for up to a few hours has a low nicotine flux. So this suggests that nicotine flux might be appropriate to determine appropriate duration of use, but does not predict nicotine yield or dose. This might be because there are many factors that influence nicotine delivery outside of nicotine flux and emissions from the device. These factors were outlined in a paper from 2017 by Tala et al., and they have evaluated variables that contribute to the rate of nicotine emissions, but what they did not find was a relationship between nicotine delivery or nicotine emissions and protonation and aerosol particle size distribution. And these two factors are very important when it comes to inhalable products like e-cigarettes and heated tobacco products. We assessed whether nicotine flux results in increased systemic exposure or is associated with pharmacokinetic parameters of nicotine delivery. As nicotine flux might not fully capture nicotine dose or final delivery, we propose that the rate of systemic nicotine delivery is the most relevant parameter that captures product-specific metrics. This is defined by Cmax over Tmax, or the maximum concentration of nicotine delivery to the blood divided by the time it takes to get there. As we can see here, there is little relationship between nicotine flux and Cmax over Tmax, but a stronger relationship between product type and Cmax over Tmax. For example, we can see here that there is the nicotine inhaler and mouth sprays have a similar or higher nicotine flux than from a cigarette, but the Cmax and the resulting PK are very different. Further, a rise, if you're looking at the cigarettes and e-cigarettes category here, a rise in the nicotine flux within these products did not result in a meaningful increase in Cmax over Tmax. So what does this all mean? Well, we're more interested in how these products help people switch away from cigarettes. And another way to look at this, this issue is how these products may predict quitting or successful switching. We examined studies that reported 52-week quitting or switching as a function of either nicotine flux or Cmax over Tmax, and we found almost no relationship between nicotine flux and 52-week quitting when it defined by nicotine flux. Sorry. And if you look, I missed a sentence there. If you take into account a 10% quitting, a successful quitting rate that is achieved by a lot of, most quitting attempts, you get about a 10% quitting success rate. You can see that there is almost no meaningful difference as nicotine flux increases. But we did find a positive correlation between Cmax and Tmax and 52-week quitting success rates. So we propose that a Cmax over Tmax is a more appropriate parameter to be regulating nicotine concentrations, nicotine limits with. So we understand that there is a need to regulate these products to ensure that abuse liability is balanced with the potential for these products to help people switch. But we propose that nicotine flux and device and emission characteristics do not predict this metric, and as of now, make a poor regulatory target. Thank you.